ladies and gentlemen, thank you very much indeed. So what I'm going to talk about is beyond the 5 questions. For those of you who are familiar with the way that the CQC works, we are the independent regulator of adult social care, primary medical services and hospital services, which includes ambulance, independent healthcare and so on. And our stated purpose is we make sure that health and social care services provide people with safe, effective, compassionate, high-quality care, and we encourage care services to improve. And we base our assessment, certainly in the hospitals setting, on 5 key questions or domains: the safe domain, an effective domain, the caring domain, a domain around responsiveness, and a domain around leadership within both the core service. And since 2017, we've made an assessment of the leadership of organisations themselves, and I'll come back to that point. What I want to highlight at the moment is that whilst we are making some improvements as a country, we do this only in England. You'll see that on the bar chart on the left, the number of trusts which we rate requires improvement is falling, at the same time as the number of acute trusts that are rated good is increasing slightly. But we are concerned, if you look at the bar chart on the right and the horizontal bars, that at the top, in that safe domain, there is still, in our view, far too many organisations where, for that safety domain, we haven't seen the shift from requires improvement actually moving on to good that we would like to see. So one of the seminal reports over the last few years that's landed that I think we all need to reflect on is Bill Kirkup's report on to multiple failings in the maternity department at Morecambe Bay. And I really like this quote because I think it gets to one of the nubs of the issue that we all need to grapple with. And it is this: the prime responsibility for ensuring the safety of clinical practice, clinical services, rests with the clinicians who are providing them. But the prime responsibility for ensuring that they provide safe services and that the warning signs of departure from standards are picked up and acted upon lies with the trust. And as I say, since 2017, we've been performing an assessment of trust leadership, what we call the well-led approach. And we do that in combination with colleagues at NHS Improvement, now, of course, NHS England and Improvement, who do a component part of that they call use of resources. And I think what's fair to say is that we're learning all the time that the importance of leadership at that organisational level, the importance of good governance processes, of properly functioning assurance through the organisations, that's absolutely key to the delivery of safe services, and it's something that we will focus on and we'd really be interested in your feedback on, and I'll come back to that as I talk about our new strategy that we'll be developing through this year. But if we think back to Mid-Staffordshire, which was the forerunning failure in the system that led to our current inspection approach, I just think comments like this are things that we should really take to heart, reflect on, and think about how we make a change in the way that every patient interaction happens. When asked to describe the nursing culture on Ward 11, she said they were bullies. They bullied the other staff and they bullied the patients. There was no word for it, particularly during the 2 weeks Mum was dying. Effectively, they were calling out for the toilet and they just walked past them. In response to the events at Mid-Staffordshire, there were a couple of reports were commissioned. One was Sir Robert Francis's report, which you just saw, but the other one, which I refer to a lot, was Don Berwick. Don Berwick produced this report when he was asked to look at the safety improving the safety of patients in England. And I think that this encapsulates what I want to talk to you about today, the underpinning, what's the different approach that we're going to take to the 5 key question idea. And it's a focus on people, and you can read that for yourself. Don Berwick very eloquently talks about that. The people that we would ask people to focus on are primarily those who use services, and we wouldn't just want their experience to be gathered, we'd want them to be involved in their own care as partners in their care. We believe that creates safer conditions for care, and we'd also want them to be involved as individuals and group representatives in order to support planning of services in the future. But equally, it's about staff. If you go back to Kirkup's report, talking about that responsibility that each clinician who lays hands on patients has for providing safe services, one of the underpinnings of that, of course, is that they are provided with the training and continual development support in order to help them deliver safe services. And partly that is due to team working as well, and I'll come back to mention that later. But also it's about curiosity. Curiosity about how we can be better tomorrow than today. And we're learning a lot more about what it takes in an organisation to set the conditions where people can be curious and feel safe to say when things aren't going well and suggest areas that could be improved. We call that psychological safety. Many of you will have heard of that term. But teamwork is important, and we know we're not the only people to have published evidence on this, but we know that allowing every single member of staff to be their best self and feel safe to do so when they're at work, feel really genuinely committed as part of teams, that's how you get safe care. That takes committed leadership both at the top of an organisation and throughout the leaders at the various tiers to make sure that those fine words that are often spoken about equality, diversity and inclusion are actually translated into actions that mean for all those concerned they can feel safe and become partners, effective partners in leading change. And that's echoed in another publication from Don Berwick's institution, the IHI, this framework for joy at work. And it's the idea that if we as leaders of either systems or organisations or our component parts of organisations provide an environment in which our workforce are engaged, they can bring that best self to work, it's associated with fewer errors, better patient experience, less waste, higher employee satisfaction and less absence, and you get that more discretionary effort on the part of staff. One of the references in that document is quite interesting. I find it was a publication that dates back to 2009. It was the Department of Business actually published this, but in that document, which wasn't just aimed at the health service, it was about staff engagement, they mentioned one of the CQC's predecessor organisations, the Healthcare Commission, and when they compared staff survey results to the ratings that were eventually given to the organisations, then they found quite a strong correlation at that time. But they also pointed out, as you can see at the top of this slide, that actually in the public sector at that time, the evidence would suggest that around 2009-10, actually, there was quite a high staff disengagement and a relatively low, really engaged staff culture. And what we also can take from that study was that employees who work for an engaging organisation get an organisation they feel proud to work for. They get managers who are more likely to listen and care for them, leaders who listen to them and inspire them, opportunities for growth and to support each other. So it's a good thing all around, and we as leaders have got the responsibility to put those conditions in place. I mentioned a focus on people, on the people that use services and on staff, and we at the CQC administer the outlier reports for a number of national surveys, both patient and staff. You can see some of the recent ones that have been published there. The patient survey results that have been published recently, community mental health, clearly there is significant scope, as I mentioned, to involve people in helping to plan the services that they feel are most appropriate for them. For children and young people, actually, that was quite encouraging. The majority of those young people really did feel that some of those communication routes were improving. For urgent and emergency care, and I think those of you who work in the acute sector will recognise this, there's something about the interfaces between the parts of that system that could be done better. And in the maternity service, the maternity survey, which was published very recently, I'm pleased to say that there were a number of areas of improvement in that survey, but one of the things that we could still all focus on a bit better is postnatal care. For staff, the NHS Staff Survey, we map that to our well-led domain, both at a core service level and at an organisational level, whereas the patient experience surveys map to our caring and effective domains. What we try and say to organisations is, look, there's a very high-level national publication, but you can get the breakdown by your own organisation, and we would encourage everyone to use that as a start of a conversation, on the one hand with patient groups for the different survey areas, and on the other for conversations with staff. And what, as I say, we think we are beginning to see, although we've not done it as formally as it was done in the old Healthcare Commission days, is that link between certainly staff experience and better patient outcomes. And the King's Fund recently published something similar, talking, as I've mentioned to you already, about staff sickness rates, staffing levels, staff well-being, patient experience, all linked. And those are things that are completely within our gift as leaders to reach out to both people who use services and our colleagues to find out what we can do to help improve their experience. This is an interesting bit of the staff survey that I would encourage all of those of you who work in acute trusts to focus on. I remember back in the early cancer days when Mike Richards was the cancer czar, being the only person in the room who put their hand up in response to his question, who would be happy to have either themselves or a family member treated in the trust where you work. And it astonishes me that even at an amalgamated level, that's still only 70%. That means that 30% of people working in organisations in the NHS wouldn't recommend or be happy for themselves or their family to be treated in organisations. I find that something that we need to get underneath as a matter of some urgency. I'm not going to dwell on quality improvement, but certainly one of the things that we see in outstanding organisations is leadership groups at both organisational level and at core service level who are really beginning to think about how they use a methodology to formally support people to make improvements to care. We know that that's difficult, but we think that that's one of the ways that certainly the outstanding organisations are giving a lead to the rest in terms of how they do this, and we've got some publications which have got case studies in that. And I can't emphasise enough how much we at CQC, and I think it harks back to the end of the talk that I heard about involving patients and their families when things go wrong in investigations. We would say that in any endeavour in an organisation, if you don't have the patient and public voice involved right at the heart of what you're doing, that's something that is causing you to miss out on enormous opportunities for improvement. So just as I close, senior leadership we think is really, really important. We think we can pretty much map an outstanding, well-led organisation to then our expectation that we'll see good or indeed sometimes outstanding core services in that organisation. Those leaders take that personal accountability for setting the culture that improves, that encourages improvement. It supports staff to feel psychologically safe. And it's a responsibility for it all. You can't just point at a chief executive or a chief nurse or a medical director. This is the responsibility for all of us at whatever leadership level we are in a trust to really contribute to this. It's a joint endeavour. So it's about people. It's about being kind in our interactions, absolutely, of course, to those who use services, but to each other. And there are considerable pressures on our system, all across our system at the minute, which sometimes people under pressure, it's very difficult to retain that kindness and civility to each other, but it's an underpinning feature of outstanding organisations. It's an underpinning feature of Aidan Fowler's new NHS patient safety strategy, and it's something that we would really try and encourage people to cling on to. And we all need to be curious. We all need to work out how we can be better tomorrow than today, and in a supportive framework, try, test and move forward. I mentioned a little bit at the beginning, we're developing our new strategy this year. There will be opportunities, I hope, for you all to feed in and comment and make suggestions to that. And we definitely want our new regulatory approach for the next 5 years to better reflect the needs and wants of people who use services, but also we want to try and make sure that that is not too burdensome for the people that provide the services and is seen to be using any levers that we have to encourage improvement. We now have podcasts. We have moved firmly into the 21st century, ladies and gentlemen. And if you are so disposed on your long training journey home, there are a number of podcasts that you can access from the CQC free of charge to entertain you on your way home and hopefully inform you. And in addition to that, for those of us who are more used to traditional media forms, we have a number of publications where not only do we bring together our findings for all of our adult social care, primary medical services and hospital services each year, but also we try and build some themed reports to help people in various areas of improvement. Ladies and gentlemen, thank you very much. I look forward to the panel discussion.